this is what you guys will do, or even this, which I like. This is really good. But you guys will do this, kind of like a half-ass lean over, and kind of lifting your arm up at the same time. The problem with doing that is when it comes to the AC joint, which is one of the parameters to this splint, you miss it. You might have it whenever they're out like this, but the second you bring their arm down and you bring them up to me, it is now short. Okay? Because if I bring it up, the splint will come up. Bring it down, then the splint's actually down. So, very common problem with this splint. Again, you can make this non-removable or removable. Most of the time, acutely, they go non-removable. But they're very loosey-goosey. These patients do not do well. They have to sleep at like a 45-degree angle. If you let them fall on their back or let them sleep on their back, the bone will actually bow posteriorly. So you don't want to do that. They actually have to sleep at a 45-degree angle. It always has to have a collar and a cuff with it. What does that mean? Not a sling. The sling supports the elbow. You don't want that. We actually want traction on the elbow. What does that mean? I want someone pulling on this elbow at all times. Well, I'm not going to go home with the patient and pull on it 24/7. So we just let gravity do it, and it works fine. But the second they put support under their arm, they now displace it. These fractures will always go into a varus state. What does that mean?
Less than normal.
Varus, come on.
Less than normal. Angle.
It turned.
How about apex lateral?
Yeah.
Okay? Apex lateral. Why is that? Because the human body's there. It can't go into valgus. Plus, you have the deltoid that kind of wants to pull up. It's one of the bigger muscle groups in the shoulder. So it wants to pull the proximal portion up, brings the other side out, so it'll almost always go into varus. Okay? So you're always fighting that stress. How do I do this? Most of the time, I have them leaning over just like that. Perfect. And these take a little while because the patients just are in so much pain. This, I guess, would be a non-removable one. The removable ones I still use. A lot of times nowadays we go into these fracture braces. They'll be in this splint for a few days, maybe up to a week or two, and then we transition them out of this and we try to put them in a fracture brace. A fracture brace is like a thermoplastic that is supposed to fit everybody, and it doesn't fit a single person. So, I think my cooptation splints, removable ones, work actually a lot better. AC joint, right here. That's the tip of his AC joint. I want you to try to get there as close as you can. So what I do, I'll actually pad higher. See how my Weberl wants to slide down his arm because it's such an angle?
How far up the forearm do you go?
Well, I'm just trying to pad the edge of my plaster. So if I'm going to use a 4-inch roll of plaster on him, obviously I need to go 4 inches. But most people I can get away with a 3-inch roll. So I'll use this for the non-removable, but for the removable, I'll use this for the removable 4-inch roll. Your parameters are 2 finger breaths from the axilla. So you don't want it pushing right up into his armpit. You want a little bit of a space, 2 finger breaths. It's going to wrap around, come back up, and go all the way to the AC joint. Okay? As soon as I get this splint on him, the first thing I'm going to do is sit him up straight. I will measure my splint all the way up in the axilla because I'm afraid of shrinkage. One more. Okay. Oh God.
I think these might fit a little better.
Need the Magnum size.
This I just did 8, but 8 to 10, same as anything else. The nice thing about plaster, see how he's kind of sitting up? In real life, they'll stay leaned over like this until they pass out, but it feels so much better. And I am going to get your shirt a little dirty. Let your elbow straight. Just your elbow.
And would you still put this on if it was compound?
Normally we operate on those, and even if it was an open fracture, even if it was an open fracture, we would you would put this on with maybe a dressing over the wound until you went to surgery. These people are in a lot of pain. That's where you get spit. No, normally these people pass out on you.
Awesome.
So notice what I did, I just came and pushed him forward. Still hanging onto his elbow. I'm pushing him forward and holding my splint up because gravity wants to pull it down already. So I'm kind of making sure it's molded. I don't have any wrinkles around the elbow.
Does it matter if the forearm's supinated or pronated?
Does not make a difference. It will make a difference in reduction. But at this point, being acutely, these fractures are very loosey-goosey, meaning they'll just kind of wobble around for a couple of days. Patients will tell you, I go to the bathroom and I hear it clicking and popping,
Yes.
They don't start to get stuck for about 2 weeks. So this fracture will be 2 weeks old before they stop hearing that so much and even feeling it. We call that crepitus. Again, no plaster on the patient. AC joint, I'm right at it.
What about sleeping, Chris? How do you tell him to sleep?
45-degree angle and lazy boy. I mentioned that already. They lay flat on their back. Remember, they just don't stay reduced. So they have to sleep. For the next 6 weeks, they're going to be sleeping in a recliner. 45 degrees. Okay? Sounds brutal. It's not bad. Because you can drink.
Do they actually listen to you?
This is pretty cool. You just wake up.
It's like half of it.
Do they actually listen to you? Do they actually listen to you and do that?
Sleep at 45?
Yeah.
Oh yeah. Oh yeah. They have to. Because the second they lay down, it hurts.
Right.
it's pretty much good to go. I'm just holding them, not allowing them to move once it's on. On the other side, let's go ahead and take this off.
I used 4 inch.
This I used 4-inch. I could get away with 3 on him, but 4-inch worked out pretty good. He's got a pretty decent sized arm. It holds his elbow at 90 degrees.
You can let go of your thumb now. Just saying.
No, he can't let go of it. So he's still drying.
You said all of those have a collar and cuff?
Yes, very good, before I got too far.
Yeah.
This is a collar and a cuff.
Do we actually have to do that part?
Oh, it's like that. I'm not in a sleeping apnea. Oh, it's like a little sleeve.
It's like
It's like those kids at the mall with the thing.
The monkey back there?
It's not
See
a
that?
leash, it's a monkey back there.
Not bad.
Yeah.
They're not in a whole lot of pain as long as they stay in one position, you know? Either standing up or at that 45-degree mark. That's a collar and a cuff.
How is the collar pulling the elbow down?
It doesn't. Gravity's pulling it down.
Oh, okay. So it's just holding the head.
Yep, and see, if I lay down flat on my back, gravity's now going that way. Or if I sleep at a 45, it's still going down. That's why you have to maintain the 45 degrees.
There's a part up here that's not too low, that's fine.
AC joint right there, right at the tip. Let's see what you guys bring me. This is where you guys